Okay, welcome back to our next video in our video series on medical terminology. In this video, we'll discuss chapter number 6, the skeletal and muscular systems. First off, the learning objectives for this chapter. Define and spell the word parts used to create medical terms for the skeletal and muscular systems. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with skeletal and muscular systems. Build medical terms from word parts associated with the skeletal and muscular systems. And lastly, pronounce and spell common medical terms associated with the skeletal and muscular systems. First, start off with some anatomy, physiology, some word parts for both of these systems. The first two reference the same thing. Arthro and articulo are reference to joints. So we think of arthritis, you have an inflammation of the joints. And an articulation is another term for a joint, a place where two bones meet. The next one, bursa, is a reference to the bursa, which is a sac of fluid that's found near joints. Carp or carpo is a reference to the wrist, in more particular the bones of the wrist. And the last one on here, chondro, is a reference to cartilage. See the next one, condyle, is a reference to a rounded mass or a rounded protuberance on the end of some long bones, usually where they meet another bone to form a joint. Cost or costo is a reference to a rib. Cranio is a reference to the skull. Fascio is a reference to the fascia or the fascia, which is a type of supporting connective tissue. Femoro is a reference to the femur or the thigh region, the large bone of your upper leg, that's the femur. Fibro is a reference to fiber of some kind. Fibulo is a reference to the fibula, which is a bone in your lower leg, one of the two bones of your lower leg. Ilio is a reference to the ilium, which is one of the bones that make up the pelvis. And that goes along with the last term on here, ischio, as a reference to the ischium, which is another bone that makes up the pelvis. Menisco is a reference to the meniscus, and a meniscus is a thin band of cartilage that's found in between two bones, like in between the bones of the knee, for example. Musculo is a reference to the muscles. Same thing with myo or myoso is also a reference to muscle. And the last one here, myelo, is a reference to the either the bone marrow or the spinal cord. The next one, ortho, is a reference to straight. Osteo is a reference to bone. So an osteocyte would be a bone cell. Parieto is a reference to a wall of the body. Patello is a reference to the patella, which is the technical name for your kneecap. Pedo is a reference to both a child and also your feet. And last one on here, petro, is a reference to stone. Phalango, these are references to the phalanges, which is another term for your digits, so your fingers and your toes. Phys or physo is a reference to air or gas. Pube or pubo is a reference to the pubis, which is the front bone of your pelvis, the pubic bone. And the last one on here, radii or radio, is a reference to X-rays or radioactivity, or the radius, which is a bone in your forearm. The next one, sacro, is a reference to the sacrum, where you'll find your tailbone. Skeleto is a reference to the skeleton in general. Spondyle is a reference to the vertebrae in the backbone. And stern or sterno is a reference to the sternum, or your breastbone. Synovo or synovio is a reference to the synovial membrane, which is a membrane that will produce synovial fluid that will help to lubricate space between the joints, or between the bones of a joint. Tarse or tarso is a reference to the tarsus, which is your ankle bone. Tendo or tendono versus the tendons. And vertebro is a reference to the vertebrae. Alright, now we'll talk about more details of the skeletal and muscular systems. Sometimes you'll see these covered individually as just the skeletal system or just the muscular system. And sometimes you will see them combined together. So that's when you get the musculoskeletal system. And these have to work hand in hand in order to support the body and to produce body movement. Your muscles have to attach to something so your body is able to move. Your muscles have to be attached to your skeleton. And it's like any other body system, these are subject to injury and inherited disorders, as well as many kinds of diseases. Alright, we're talking about the anatomy of the musculoskeletal system. Of course, for the muscle part of that combination, you'll have muscles, then you also have tendons and ligaments. Those are two separate things. They are not the same structure. And for the skeletal portion of this combination, obviously that will include the bones. Here's a common example of a long bone. a bone that is longer than it is wide. This will actually be the bone of your upper arm, the humerus. And bones will come in various types of shapes and sizes. But your shoulder would be up here. And then you have the ends of the long bones are called epiphysis. So you have an epiphysis here. You have the shaft of the long bone, the diaphysis. The other end of the long bone. Then you have the hollow chamber in the middle, where you'll find the bone marrow and where blood cells are created. Here's a anterior view of a skeleton. There are 206 bones of the skeleton, and obviously not all of them are listed here or named here. But of course some easy landmarks, of course the skull, the sternum, thoracic cage, the rib cage, the collarbones, upper arm, humerus, the two bones of the forearm, pelvis, femur, the main bone in the thigh. There are two bones in the lower leg, then all the ones in the feet. There's an anterior view of some of the major muscles found in the body. There are over 640 muscles in the body, so it'd be really difficult to find one image that has even half of those identified. But there are some common ones. The major muscles of the head and neck, the chest, the pectoralis major and minor, of the arm, the biceps, brachii, the main muscle that you flex, muscles of the leg, the quadriceps, muscles of the lower leg, the calf, for example. Alright, next we'll talk about some pathophysiology terms when it comes to these two systems. The first one, orthopedics. This is a medical specialty that deals with the functional impairment of the skeletal system. And someone who practices in this field of medicine is an orthopedist. Alright, now we'll talk about some signs and symptoms, some word parts that go along with these two body systems. The first one, A, is a reference to without. Brady means slow. Dis means difficult or painful. Then hyper means in excess of or higher than normal. Arthro is a reference to a joint. Kinesio is a reference to movement. Myo is a reference to muscle. Tax or taxo is a reference to coordination. Ten or teno is a reference to a tendon. And the last one on here, troph or tropho, is a reference to either development or nourishment. Alright, some suffixes. The ending of the vowel A is a reference to one in Latin terms. So an example we've talked about before, a vertebra would mean one bone of your backbone, one vertebra. If you have more than one, it'd be vertebrae. It would end in AE. The ending algia is a reference to pain. Dynia is also a reference to pain. The suffix IA, a general condition. Then the ending with the letter Y, it also means a process or a condition. Alright, now we'll talk about some signs and symptoms of the skeletal and muscular systems. The first one, arthralgia, is a technical term for a pain in the joint. The next one, ataxia, is where you have a loss of control over your body movements, a total loss of control usually. The next one, atrophy. If we're to break this word down, A means without. Tropho means nourishment or development. Then Y, a process of. So atrophy is the process of having no development. This is when muscles will waste away when they aren't being used. The next one, bradykinesia, is another word for having slow movements. It's something that you'll often see described with a patient who has Parkinson's disease, for example. It's your body's inability to adjust the body's position because it moves so slowly it can't adjust properly. And last one on here, decalcification, is where bones will lose calcium, which will make them weaker. So you are removing the calcium portion of the bone. The next one, dyskinesia, is an impairment of normal voluntary movements. Dystrophy is a disorder where an organ or a tissue will waste away due to the impaired nourishment of that tissue or of that organ. An example of this would be muscular dystrophy. The muscles are starved from nourishment, so they will basically just waste away. The hypertrophy, this is an enlargement of an organ or of a tissue due to an increase in size. The myalgia is where you have a pain in a muscle or in a group of muscles. And last one on here, tenodynia, is a reference to pain in the tendons. This term isn't used as often as it used to be. More commonly used term now is tenalgia, but they both reference pain in the tendons. Alright, some other word parts when it comes to diseases and disorders. Prefix A, again, means without or lacking. The epi means above. Para means nearby or alongside. Poly means many. And quadri means four. See some larger word parts. Ankylo, that's a reference to being stiff. Arthro is a reference to joints. Burso is a reference to the bursa. Carcino is a reference to being cancerous or cancer in general. And last term on here, carpo, is a reference to the carpals, which are the bones of the wrist. Chondro is a reference to cartilage. Condylo is a reference to a condyle, a rounded projection at the end of a bone. Fibro is a reference to fibers. Kypho is a reference to having a humpback. And leuco is a reference to white. Litho is a reference to stone. Lord or lordo is a reference to having a sway back curve where your lower back curves inward more than it should, the opposite of having a humpback. Menisco is a reference to the meniscus. Myo is a reference to muscle. Myelo is a reference to the spinal cord, or also the bone marrow. And myos or myoso is a reference to muscle. Osteo is a reference to bone. Poro is a reference to an opening or a passageway of some kind. Sarco is a reference to flesh, not to confuse this with sacro, which is a reference to the sacrum. Scolio is a reference to being bent or being crooked. Think of scoliosis as the spinal column will curve instead of being straight. And last one on here, spondylo is a reference to the backbone or the vertebrae in the backbone. Synovio, reference to the synovial fluid or synovial membrane. Tendino is a reference to tendons. Algia is a reference to pain. Asthenia is a reference to having a lack of strength. The suffix seal is a reference to having a hernia. And then the ending emia is a reference to being of the blood or a blood condition. Genesis is the formation of or the creation of. Itis means the inflammation of. Malacia means the softening of. Oma is a reference to a tumor. And osis is a reference to an abnormal condition. The first one here, plasia, is a reference to formation or development. Plesia is a reference to paralysis. And the last one on here, ptosis, is a reference to drooping or sagging or even protruding. Alright, now we'll talk about some specific diseases and disorders of the skeletal and muscular systems. The first one, achondroplasia. If you were to break that word down, the prefix A means without. Chondro is a reference to cartilage, and plasia is a reference to formation. So we put all those together, without the formation of cartilage. This is a condition that will lead to someone having very short stature. This is actually a type of dwarfism. The second one, ankylosis. This is a condition of having abnormal stiffness or the inability to move a joint due to the bones fusing incorrectly. Here's an image of someone who has achondroplasia. Due to the lack of cartilage, the limbs will be much shorter than they should be. So the result is a form of dwarfism. The next one, arthritis. It's a general term that covers inflammation of the joints, which will lead to pain and lead to stiffness. Usually will get worse as we get older. There's more than one kind. The first one, OA, osteoarthritis. This will involve the wear and tear damage to the joints. As we get older and as the protective layers of cartilage on the end of the joints will slowly wear down, just due to normal wear and tear. So that inflammation of those joints is due to just normal use, and that leads to osteoarthritis. The second one, listed RA, rheumatoid arthritis, is an autoimmune condition. This is where your own immune system will attack the lining of your joints. And those attacks lead to the inflammation and the disfiguring of the joints, especially in the hands. See, and the last one here, inflammation. This is where you have a particular part of the body becoming swollen or hot or red or painful. This is caused by an injury or an infection. All right, this image, we have someone suffering from osteoarthritis. The joints of the fingers have become swollen. You can tell by just looking at the image that they would probably be painful. All right, this image, we have the regression of rheumatoid arthritis. You get the attack of the synovial membrane here. That membrane being attacked will cause it to become inflamed and swollen. Then we'll start to wear away this cartilage here on the ends of the bones. Then we have that loss of membrane. You have the loss of the synovial fluid, which is the lubricant between these bones, which will lead to a very stiff, very a painful joint. And then it gets to a point where the joint is completely deformed and unable to move. So you have a complete loss of the joint itself. Arthrochondritis is the inflammation of a particular type of cartilage called articular cartilage. And this type of cartilage is found on the ends of joints that will help form a joint between bones. And articulation is another word for a joint. The next one, bunion. This is a painful swelling found on the foot, usually on the first joint of the big toe. Bursitis is the inflammation of the bursa, which are small fluid-filled sacs between bones, usually in the knee is a good example. And they're there to help cushion the bones and the tendons and the muscles around that joint. So bursitis is usually common in the knees or in the shoulder or in the elbow or in the hip. Bursilith is where you have a stone that forms within the bursa. Lith is a reference to stone. The last one on here, CTS, carpal tunnel syndrome. This is a condition that has chronic pain and numbness and tingling in the hands, usually in the last 3 fingers. It's caused by repetitive action, such as typing on the keyboard. The position that the hands and the wrist are placed in put pressure on the median nerve, and that constant pressure will lead to the tingling and the numbness. That's why you'll see many keyboards are now ergonomic, so they're basically broken in half, so your wrists aren't bent as your hands are on the keyboard to type. So with an ergonomic keyboard, your hands are able to be placed straight onto the keyboard itself, causing no bending, no pressure on the median nerve. See, next one, carpoptosis. This is also known as wrist drop. This is where you have a paralysis of the muscles that are used to extend the wrist and the fingers. So if those muscles aren't able to work, then they can't extend the wrist or extend the fingers. That's why this is called wrist drop. Next one, cramps. This is where you have a involuntary contraction of a muscle. Usually it's quite painful, caused by fatigue or a strain. Next one, DJD, degenerative joint disease. And like the name implies, this is where you have a joint that is degenerating or breaking down, or the condition of having a joint break down over time. This term is a synonym for osteoarthritis, wearing down of a joint over time. And the last one on here, DMD, Duchenne muscular dystrophy. This is a very severe form of muscular dystrophy, more commonly found in boys than in girls. And this is caused by a genetic defect. This will cause progressive weakness and also the loss of muscle mass over time. See, going back to the first word, for you to break that down, carpo represents the wrist, and ptosis means drooping. So this is where you get the wrist drop phrase for this condition. See, next term, epicondylitis. This is a condition where you have a painful inflammation of the tendons that are around an epicondyle. An epicondyle is a feature on a bone. A condyle is a rounded projection. So the epicondyle will be the area just above that. And some common versions of epicondylitis are tennis elbow and golfer's elbow. So the next one on here, fibromyalgia syndrome. This is a chronic disorder that's indicated by fatigue, pain within the muscles, being very tender at particular spots throughout the body. You can also have memory issues or mood issues, something that's very often misdiagnosed because it can present as so many other different things. The next one, fracture. This is a generic term that references a cracking or a breaking of a bone. And there are multiple different kinds of fractures depending on how the bone is broken. The first one, Colles Fracture. This is the kind of fracture that you get if you were to fall and your arm was extended and you hit your wrist. This usually takes place at the distal end of the radius, or the far end of the radius. And of course this will result in a broken wrist. Second one on here, comminuted, is where the bone breaks into 2 or more pieces. So this kind of break would take a good amount of force to shatter a bone in that way. See the next one on here, compression fractures. This is found in the bones of the spine, where they become weakened or they start to crumble. So they are compressed onto the bone next to them. And the last one on here, displaced fracture. This is where you get the bone breaking so the pieces of the bone are not aligned correctly. See next one, epiphysial fracture. This is a fracture at the epiphysial plate of the bone. This is the area of the bone where you actually get active growth at the epiphysial plate. This is typically more common in children. As we get older, the epiphysial plate will get smaller and smaller, and when we reach our late teens or early 20s, the epiphysial plate actually becomes fully ossified. It turns completely into bone, because when we have active growth, it is actually a band of cartilage. See, next one, Greenstick Fracture. This is a type of fracture that's typically found in children, where you have one side of the bone that's broken, but the other side of the bone is not. It's only bent. So it looked like a small branch of a tree. If you were to bend a small branch of a tree, part of it will completely break through, but the other part will just bend in half. And again, this is usually found in children under 10 years old. The next one, non-displaced. In this kind of fracture, you'll have a break in the bone, but the ends are still aligned correctly. The next kind, Colles Fracture. This is a reference to a fracture of the ankle, where you get a fracture in some of the parts of the bone that stick outward, some of the prominences that stick outward. When you look at your ankle, the part that kind of juts outward on the inside of your ankle, or the part that sticks outward on the outside of your ankle. Because they jut out, they're a little bit more prone to being injured or fractured. So when those are fractured, that's called a Colles fracture. And this usually happens whenever you roll your ankle. And the last one on here, a spiral fracture, also known as a torsion fracture. This usually happens when your body is rotating, but one limb is planted and not moving. So your body is causing your limb that is not moving to be twisted. So you're having torque or torsion applied to the ankle that's not moving, for example. All right, here are examples of some common bone fractures. The first one, a transverse fracture, where it goes all the way across. That's the oblique fracture, where it goes in a diagonal direction. Oblique is always a reference to diagonal. Spiral fracture, you can tell the torsion or the torque is placed on this bone, causing it to turn itself around, and as the body spins around, it causes the bone to break like this. A comminuted fracture, several pieces that are produced as the bone breaks. This one, a pathological fracture caused by a bone disease or by a tumor. It looks a little bit different than the rest of these because the bone is rotted away from the inside, which will lead it to becoming more easily fractured. A Greenstick fracture, you see how it's broken here, but only bent right there. This one we didn't talk about, buccal fracture, but it's another one that's more common in children, where you literally have the part of a bone buckling. And this is often pretty common in children because their bones are softer. This is another term for an incomplete fracture, this buccal fracture. And a compression fracture, the bones in the vertebrae are breaking down, so the bones on top will cause it to be crushed. It is compressed. The next one, gout. This is a condition where you have very high levels of uric acid, and when uric acid is not removed properly, it will form small crystals, and these crystals will lead to arthritis, especially in the bones of the feet. The second one on here, a herniated disc. This is found in between the vertebrae of the spinal column. In between each vertebrae, there is a cushioning, basically a shock absorber layer of cartilage. And then whenever these discs become injured or weakened, the outer part will tear open, and then the rest of the disc will herniate or stick out through that weakened opening. And this can lead to the vertebrae pressing on the vertebrae next to it, which will cause pain, or even on the spinal cord or some nearby nerves and causing pain. It's also known as a slipped disc. This image, we have an example of gout. The high levels of uric acid will form crystals in the joints of the feet, usually in the small bones of the feet. You'll see it obviously building up here. On this image, we have an example of a herniated disc. See here you have this disc that should be shaped just like this side, becoming compressed because it is weakened. That will lead to pain and even potentially the loss of movement, depending on how bad the herniation is. These next three all deal with the curvatures of the spine, or abnormal curvatures of the spine. The first one, kyphosis, is also known as hunchback, where your upper part of your back is curving more anteriorly or more toward the front than it should. See, the opposite of that, lordosis, is often called swayback, where your lower part of your back curves more anteriorly than it should. And last one, scoliosis, is where you have a lateral curvature of the spine. curving from to the left or to the right. And here are examples of all three of these. The first one, kyphosis or humpback. This upper part here is curving more this way, so you have a hunchback appearance. Lordosis or swayback. The lower back is going more inward and forcing the belly out, so it's a swayback. And then scoliosis, a lateral curvature of the spine. This should not be anywhere near this far to the right or to the left. It should be just straight. See, next one, Marfan Syndrome. This is a condition that is caused by a genetic disorder that affects the connective tissue of the body. Now, because the connective tissue is so widespread throughout the body, and there's such a variety of connective tissue, there are multiple types of symptoms. People who have Marfan's tend to be very tall and very slender. Their arms and legs are going to be disproportionately long. Their fingers will be also disproportionately long. The sternum, the breastbone, will protrude outward or will dip inward. They'll be very extremely nearsighted. So these are just some of the many possible symptoms that you'll find with Marfan's. Meniscitis is the inflammation of the meniscus. And the meniscus is a small piece of cartilage that is found between the bones of the lower leg and then your femur, your upper thigh bone. It's very common to tear these during a sports injury. Myasthenia Gravis. This is an autoimmune condition. It's a chronic neuromuscular disorder that can lead to a varying degree of muscle fatigue and muscle weakness. Some common symptoms here would include drooping of the eyes, a weakness of the muscles of the eye in general, an impaired ability to walk. And last one on here, myeloma. Now this is a malignant tumor of the bone marrow. Myocele is where you have a herniation of a muscle through its outer sheath. Myositis is where you have a degeneration and a inflammation of muscle tissue. Osteitis is where you have a degeneration and inflammation of the bone. And last one on here, osteitis deformans. This is a chronic bone condition that leads to very large bones. These bones will be deformed because there's an excess amount of growth, and as these bones will grow, there's going to be an excessive amount of tearing those bones down and regrowth. This amount of activity will lead to bones that become too large and deformed, and also will result in bone pain and arthritis, and also lead to fractures. All right, our next term, osteosarcoma, is a name for a cancer found in the bone, more commonly found in young adults and children. The next term, Osteogenesis Imperfecta. This is a genetic disorder where the bones are incredibly brittle. Often when children are born with this, they're called children of glass because even the slightest movement can cause bones to break. So if you break down this word, you are literally having the imperfect formation of bones. Something as simple as coughing or sneezing can easily break multiple ribs. The osteomalacia, to break down this word, osteo, of course, means bone. Malacia means the softening, so osteomalacia is the softening of the bone. And last term on here, osteomyelitis, is a inflammation of the bone or the bone marrow itself. The osteoporosis is a condition where the bones become less dense. This is much more common in women who are postmenopausal. Paraplegia is the paralysis of the legs and the lower body due to some injury or disease of the spinal cord. Quadriplegia is paralysis in all four extremities. So quad means four, having paralysis of both arms and both legs. Polymyositis is a chronic inflammation of many muscles all at the same time, and the result of this would be muscle weakness, and this is an autoimmune condition. And the last one on here, rickets. This is a disease that's most commonly found in children, and it's caused by a lack of vitamin D. And what happens is vitamin D is a key factor in the bone becoming very strong, so if that factor isn't there, the bones are very easy to bend and bow. Alright, in this image we have an example of osteoporosis. For the image here in letter A, this is how a section of this kind of bone would look, or this type of bone is called spongy bone. With someone who has osteoporosis, these gaps between these bony plates get larger and larger, so they look like this. So the strength will get less and less. This is why it's very easy for someone who's older to break a hip, because the strength just isn't there anymore. It also helps to explain why, as people get older, we start to shrink in height. Now, we aren't literally becoming shorter, but what happens is the strength of the bones is getting less and less, so it can't support the weight of the body, or your body will start to hunch over because it can't stand up straight anymore because the strength just isn't there internally. All right, rotator cuff injury. The rotator cuff is basically a capsule of fused tendons that help support the arm at the shoulder joint. In reality, your arm is basically this kind of hanging there off of your shoulder. It's not that stable of a joint. So this is why it's very easy to injure the shoulder. Spinal cord injuries, of course, anytime there's any kind of trauma or injury to the spinal cord, this can be very, very serious. This could be something as serious as causing paralysis, or can even be fatal, depending on how severe the trauma is. Spondyloarthritis is a spinal disorder where you have one of the vertebra in the spinal column slip forward and actually land on the next bone below it. Of course, this will lead to back pain, numbness, weakness in one or even both legs. So it's really the forward displacement of a vertebra. And this usually happens in the lower back area, the lumbar area of the vertebrae. The next two often go together because people tend to misuse these terms. Sprain and strain. Of course, they are related, but they are not the same thing at all. The first one, sprain. This is the stretching or tearing of ligaments. A commonplace for this would be your ankle. And a strain is the stretching or tearing of a muscle or a tendon. So they're both involving stretching or tearing, but what is being torn, what is being stretched is the difference. So you sprain ligaments, you strain muscles or tendons. All right, this illustration, we have various degrees of sprains in the first, second, third degree. Of course, the higher the number, the more severe the injury is. For first degree sprain, localized joint pain, tenderness is really not that big a deal. For second degree sprain, there's a detectable joint laxity, which means a feeling of looseness. Of course, localized pain and tenderness. For third degree sprain, there is a complete disruption of the ligaments. So it's incredibly loose and very, very unstable. See the next one, TMJ, temporomandibular joint disease. This is a very common disease. It affects the joint right where the jaw meets the temporal bone. So that's where the name comes from. Temporo is the temple bone. Mandibular is reference to the mandible, which is your lower part of your jaw. So where they meet. So whenever there is pain in this joint, or if the movement of that joint becomes compromised, that is a symptom of TMJ. Tendinitis is an inflammation of a tendon. And the last one on here, tenosynovitis, is the inflammation of a tendon where it actually connects to a bone. And a tendon is what will connect muscle to a bone. And more specifically, it is the inflammation of the synovium, which is the fluid-filled sheath that surrounds a tendon. All right, now we'll talk about treatments, procedures, and devices in various work parts. Many of these we've already talked about in this chapter. Arthro is reference to the joint. Burso is reference to the bursa. Chondro is reference to cartilage. Costo is reference to the ribs. Cranio is reference to the skull. Electro is reference to electricity. Fascio is reference to the fascia, the connective tissue. Lamino is reference to the lamina, and the lamina is another term for a thin plate. Myo is reference to muscle. Ortho is reference to straight. Osteo is reference to bone. Spondyle or spondylo is reference to the vertebrae. Syn or syno means together or with. Teno is reference to a tendon, and vertebro is reference to the vertebrae. Synthesis, this is a withdrawing of a fluid, such as when a woman is pregnant, she may have amniocentesis, the withdrawal of the amniotic fluid. Chalasia or chalasis, both of those mean to break. The suffix thesis means to tie together or to bind together. Ectomy, the surgical removal of. And the last one on here, the suffix gram, is a record, the actual results of a test. Be careful not to confuse that with a graph. So if the word ends in gram, that's the actual results of the testing. Graphy is the process of recording. The iatry is reference to treatment or physician. The ending ist is a specialist. A cardiologist is someone who specializes in studying of the heart. Lysis means the destruction or the breakdown or separation. The suffix pathy is reference to disease. Plasty is the surgical repair of. So a rhinoplasty is the surgical repair of the nose or a nose job. The suffix raphy is another word for suture. Scope is the instrument used for viewing, like a microscope is used, or an endoscope is used for viewing. The scopy is the visual examination. So during an endoscopy, you would use an endoscope, the actual instrument. The suffix tic means pertaining to, and then the suffix tomi is the process of cutting. All right, next term, arthrocentesis. This is the removal of excess fluid from a synovial cavity. This is used to help diagnose gout or septic arthritis. The second term on here, arthrochalasia. This is the breaking up the adhesions that are found in a ankylosis. So whenever there's an abnormal stiffening or immobility of a joint, that is ankylosis. Breaking up the adhesions that are making this joint abnormal, that process is called arthrochalasia. All right, in this illustration, we have an example of arthrocentesis, using a syringe to withdraw fluid of the synovial cavity. And in this example, is being used to treat carpal tunnel syndrome, and this will eliminate the excess fluid in the synovial cavity, which will lessen the pressure on the median nerve. Next term, arthrodesis. This is the immobilization of a joint through a surgical means. If you were to break down this term, arthro means joint, and desis is the surgical fixation. So this term literally breaks down into the surgical fixation of a joint. You can see this as an artificial ankylosis. And a good example of this would be the fusion of vertebrae in the back, for example. Next one, arthrogram. This is a series of images focused on a joint after the injection of some particular type of dye. This is what's used in nuclear medicine or for an MRI, for example. And the last one here, arthrolysis. This is a process of restoring the mobility of a joint that was previously stiff. And this image is an example of an arthrogram. You have an x-ray of the lower back and the pelvis, and the portion that's in red right here is showing the inflammation of the intervertebral disc, the disc between the two vertebrae. Our next one, arthroplasty, is a surgical reconstruction or the replacement of a joint. Remember, plasty means the surgical repair of, arthro means joint. Next term, arthroscopy, is a procedure for diagnosing and treating joint problems. So this is a process of viewing the joints, and the tool that you would use during this procedure would be an arthroscope, the actual device to use for viewing. And the last term on here, arthrotomy. This is cutting into a joint, either to reconstruct a joint or repair a joint or to drain fluid. The generic cutting into of a joint is called arthrotomy. This illustration, we have an example of arthroscopic surgery, and here we have a knee joint that's being examined or being repaired. So this whole procedure would be arthroscopy, and the tool used here in the surgeon's hands would be an arthroscope. Bursectomy, the surgical removal of a bursa. Chiropractic is a medical specialty that deals with using the hands to manipulate the muscles and the spine. And someone who practices in this field would be a chiropractor. And last term on here, chondrectomy, is the removal of cartilage. Ectomy is always the surgical removal of. Chondro is reference to cartilage, excision or removal of cartilage. Chondroplasty, the surgical repair of cartilage. Costectomy is a surgical removal of a rib. Cranioplasty, surgical repair of the skull. And craniotomy is a surgical opening into the skull. Discectomy is the surgical removal of intervertebral disc, the disc between the vertebrae and the spinal column. Spinal fusion, this is a procedure where vertebrae are fused together to permanently join them together. The next term, spondylolisthesis, is the surgical fusion of those intervertebral discs. This term is synonymous with spinal fusion, the correction of an unstable part of the spine by fusing it together with another bone. And the last term on here, laminectomy, the surgical removal of one or more of the vertebrae. And this is done to give access to the spinal cord or to relieve pressure on the cord or some of the nerves. Next term, Emg Electromyography. This is a process of recording the electrical activity of muscles, usually to gauge its strength or its lack of strength. And next term, fasciotomy. This is a procedure where the fascia is cut in order to relieve pressure or tension. This is usually done to ease the pressure that's on blood vessels and circulation to a limb. And going back to the first term, EMG, we break it down. Electro means electricity. Myo means muscle. And graphy is a recording process. So it's not the actual results of the test, it's the overall process of recording the electrical activity of the muscle. Alright, the next term, fracture reduction. This is just a technical way to explain the procedure to restore a fracture to its normal, correct alignment. And fractures can either be closed or open. If a fracture is closed, that means the bones do not break through the skin. And if a fracture is an open fracture, then the bones do break through the skin. So you're exposing the internal environment to the external environment, which will raise the potential for infections in addition to the broken bone. And there are many ways to reduce a fracture. First one listed here, internal fixation. This is when something is inserted internally to help stabilize that fracture or to help it heal, such as a wire or a screw or a pin or a metal plate. Something is put internally to help the fracture heal. Now, external fixation, this would be something that is used external to the body, such as a cast or a splint. So depending on how severe the break is and where the break is, will determine what type of equipment that you need. Do you just need a cast, or do you need something more internal, something more invasive? Bone grafting. This is where you take healthy bone and use that to replace the bone that has been fractured or damaged during a fracture. So it's the same basic concept as a skin graft. You're taking a piece of healthy tissue to replace severely damaged or missing tissue somewhere else, but instead of involving skin, you're involving bone. And the last term on here, electrical bone stimulation. This is a process where you're using electricity to help stimulate or induce bone growth. And this can be used to help with the overall healing process. The quicker the bone gets rebuilt and replaced, the sooner the healing process will be complete. The next term, myoplasty, the surgical repair of muscle. Again, myo always means muscle. Plasty means surgical repair of. Alright, next term, myography. This is a suture within a muscle. And last term on here, the NSAIDs, non-steroidal anti-inflammatory drugs. These are very common pain relievers. Some common examples: aspirin, ibuprofen, Aleve. All of those are non-steroidal drugs, and they're also anti-inflammatory drugs. So those are common examples of NSAIDs, non-steroidal anti-inflammatory drugs. Orthotics. This is a field of medicine that will deal with using specialized mechanical devices to help treat or to help support abnormal joints or limbs, such as a splint or a brace or an insert that goes into the shoe that will help a person deal with a problem with their arch. And the professional that deals with orthotics is the orthotist. And last term on here, prosthesis. This is an artificial body part, such as a foot or a leg or an arm. Any artificial body part, so not just a limb, it could be an artificial heart or a breast implant. All those are considered to be prostheses because they are artificial to the body. All right, next term, ostectomy. This is the surgical removal of bone. This could be a small piece of a bone or an entire bone. The next term, osteoclasis, is the surgical destruction of a bone. Sometimes bone have to be broken in order for it to heal correctly. And the last term on here, osteopathy. This is a field of medicine that deals with diseases of the bone. Next term, osteoplasty, surgical repair of bone. Podiatry is a field of medicine that deals with the feet and any conditions that may affect them. And someone who practices podiatry is a podiatrist. Next term on here, RICE, R-I-C-E. This is a method of treatment that is widely used for any number of conditions, but this is an acronym. RICE stands for rest, ice, compression, and elevation. So if you're injured, of course, rest is always good. Icing injury, compressing injury, like with an ACE bandage, for example, then elevating that injury above the level of the heart. And the last term on here, tendinomyoplasty, the surgical repair of a tendon and muscle. So it's not just myoplasty, it's tendinomyoplasty, it's tendon and muscle being repaired. So if you break that down, tendo means tendon, myo means muscle, plasty is surgical repair. So it's not just a repair of the muscle, not just a repair of the tendon, it is both tendon and muscle. Next term, tenorrhaphy. This is a suture within a tendon. Next term, tenotomy. This is cutting into a tendon. And last term on here, vertebroplasty, a surgical repair of a vertebrae. All right, now we'll go over some common definitions that you'll see with the muscular system and the skeletal system. See the first one, ACL, the anterior cruciate ligament, a ligament found in the knee when it gets very commonly torn or ruptured in sports injuries. Next one, CTS, carpal tunnel syndrome. Next one, DJD, as an overall generic term that references degenerative joint disease. DMD, Duchenne muscular dystrophy, a very severe form of muscular dystrophy. DO, this is the recognition of a doctor of osteopathic medicine. An MD would be a medical doctor, but someone who goes through osteopathic medical training is a DO instead. They're still doctors, they're still addressed as doctors. They just went through a different type of training. Last one, EMG, Electromyography, the process of recording the electrical activity of muscles. HNP is a reference to a herniated disc. It formally references the herniated nucleus pulposus. The NSAIDs, the non-steroidal anti-inflammatory drugs, like aspirin, like ibuprofen, like Aleve. The next one, OA, is for osteoarthritis. The RA stands for rheumatoid arthritis. RICE, method of treatment, rest, ice, compression, and elevation. Next one, ROM, it stands for range of motion. So when you are describing someone's injury, you want to be able to describe how well they are able to move that limb. the less the range of motion is, the more severe the injury usually is. The next one, SCI, it stands for spinal cord injury. The next one, THR, it stands for total hip replacement. And last one on here, TKA, total knee arthroplasty, so a surgical repair of the knee. TKR, total knee replacement, so not just repairing the knee, but replacing everything there. TMJ, temporomandibular joint. And the vertebrae, because there are so many vertebrae, they're usually referenced by just general region of where they're found. First group of vertebrae on the top of the neck are the cervical vertebrae. There are 7 of those, so they're called C1 through C7. So C1 would be the first cervical vertebrae. The next group after those are the thoracic vertebrae. There are 12 of those, so they're numbered T1 through T12. And the last group in your lower back are the lumbar vertebrae, and there are 5 of those. They're indicated by L1 through L5. Alright, we'll end our video with our combining form quiz. The terms on the left, costo, ortho, arthro, kypho, scolio. They'll match up with either straight, curved, rib, hump, or joint. So the first one, costo, is a reference to rib. Ortho, a reference to straight. Arthro, a reference to joint. Kypho, reference to hump. And scolio, reference to curved. Here are all the terms with their correct definitions. Alright, that brings us to the end of chapter number 6 on the skeletal and muscular systems. We will continue our video series on medical terminology with our next video on chapter number 7.